Symptoms after an embryo transfer cycle. Hi, in this video I'm going to be talking about the symptoms or the lack of symptoms after an embryo transfer. I'm Dr. Malpani. I'm an IVF specialist. I run Malpani Infertility Clinic in Colaba in Mumbai, and our website is www.drmalpani.com. And watch the video if you want to find out what you should be looking for after the embryo transfer. Now, in an IVF cycle, there are multiple sequential steps. The first half, of course, is lots of activity. You're taking injections, the doctor's doing the ultrasound scans, you're growing the follicles, you're monitoring them, you're doing blood tests to check your estradiol level. It's a lot of activity, and you can actually count the number of follicles. The doctor can tell you how many eggs you got. You can monitor your blood test levels. And then the doctor takes out the eggs and say, hey, great, we got 12 eggs. And then the embryologist calls you and shares photos of your embryos. So, hey, we got 12 embryos which fertilized, of which 10 divided, of which we've got 3 blastocysts. So lots of action going on. And you're really excited and happy and everything's going well. So now you come to the climax of the treatment of the IVF cycle, which is the embryo transfer, when the doctor shows you a top quality blastocyst, transfers that in your uterus, freezes the rest of your blastocyst, and now you wait. This is the dreaded 2WW, or the dreaded 2-week wait, where everything's now anticlimactic because there's no further medical activity. The doctor isn't doing anything else. He's put the embryo back, the doctor's done. You have no idea what's happening to that precious blastocyst inside your uterus. Is it growing? Is it implanting? Is it sticking? Is it finding its own way? What's happening? And unfortunately, there's nothing else the doctor can do to find out whether it's implanting or not, because after the embryo transfer, literally this is a black box area. So you take all your medicines and you keep your fingers crossed and you pray and say, okay, 12 days more for the blood test, and 11 days more for the blood test, and 10 days more for the blood test. And it's very easy to say 10 days more, but each of those days seems like a week. And you're going half crazy. You don't know whether you should be doing things and shouldn't be doing things. Should I eat hot food? Should I not eat hot food? Is it okay to eat veg? Is it okay to eat non-veg? People will tell you all kinds of things. Don't have papayas, have pomegranates, have this, that. Depends on who you talk to, your mother-in-law, your grandmother, your friends, which particular websites you're on. And doctors also give you lots of conflicting advice. The reality is there's nothing much you can do to affect the chances of embryo implantation. After the transfer, which is a mechanical process, the implantation is a biological process. Whether the embryo will implant is not something you can control or the doctor can control. And that can be frustrating, but that doesn't stop your mind from being active. So that irrespective of whether you're going to work or whether you're sleeping in bed, you keep on monitoring your body for symptoms and signs. My breasts feel full. That's got to be a good sign. Or do they feel full because of the medications I'm taking? Is this symptom because of the medication, or does this mean I'm pregnant? Or does the fact that I'm not getting any symptoms at all means that the embryo is not implanted? I saw a little bit of a mucus discharge. Does that mean anything? I saw a little bit of blood. Oh God. Does that mean that my period's going to start and the cycle has failed? Oh, you know what? Maybe it could just be implantation bleed. I don't know. What do? You talk to your friends, you talk to your mother-in-law, you call up your husband, you're agitated, you can't sleep at night, my body feels warm, it feels maybe like I'm going to get my period. Am I really going to get my period? Is this really PMS? Or aren't PMS symptoms exactly the same as the ones which you get when you're pregnant? You call up your doctor. What is the poor guy going to tell you? He has no idea either. He can't make sense of your symptoms. Honestly, no one in the world can, simply because there's so much overlap between the symptoms caused because of the medications you're taking, the estrogen and progesterone for luteal phase support. The same symptoms you'll get premenstrually because of the same hormones which your body normally produces. And these are the same symptoms you get if you're pregnant. So whether it's an IVF cycle after the transfer, or a regular menstrual cycle, which you're going to get anyway, or a failed IVF cycle or a successful IVF cycle, there are no differences in the symptom because it's exactly the same hormones causing the same symptoms. No woman's land, no shortcuts. You have to live one day at a time. Keep your fingers crossed. Hope and pray for the best. And it's only when you actually do the beta HCG after the 2-week wait, which is a blood test, will you know whether you're pregnant or not. Even if you bleed, even if you have symptoms, even if you don't have symptoms, please do the blood test. You can do a urine test, but a urine test is not as reliable. The blood test will give you a clear yes or no answer. If the beta HCG or the blood test is less than 10 milli international units per ml, less than 10 means you're not pregnant. Sorry, didn't work. And we may never be able to tell you why the embryo didn't implant, but that's the truth. And don't beat up on yourself if the cycle fails. It's got nothing to do with you. You can't control implantation, just like your doctor can't. And if it's more than 10, that means you're pregnant. So congratulations. But obviously, you don't just want a pregnancy, you want a baby. So you need to repeat the blood test every 3 days, make sure it rises. A good level is usually something like 100 to 200 to 300. About 12 days after the blastocyst transfer, it should keep on doubling. And once it crosses 1,000, you can do an ultrasound scan so doctor can see a gestational sac or a pregnancy sac in your uterus. I know that's a lot of information to absorb. You can always rewind, watch the video again. Have more questions, go to our website. There's tons of information at www.drmalpani.com. If you have still more questions, feel free to send me an email or fill up the free second opinion form on our website. I'll be happy to answer. We look forward to helping you to have a baby. And as an IVF specialist, nothing in life gives me more joy than helping infertile couples to start their own families. Look forward to seeing you at www.drmalpani.com.